Is the U.S. prepared for a coronavirus outbreak? Experts aren't so sure. This is America Uncovered. I'm Chris Chappell. Is the United States prepared for an outbreak of the Chinese coronavirus COVID-19? One Harvard scientist warns that 40 to 70% of the world will be infected this year.
The World Health Organization has warned against complacency from China and the rest of the world in thinking they know what's next for the coronavirus.
Let me be clear. It's impossible to predict which direction this epidemic will take.
Faced with this stark reality, there's really only one rational thing to do. Start prepping.
All you preppers that don't have coffee, this is your moment to start getting your coffee ready. Start stocking up on coffee. Bartering is going to be the number one thing.
What do you think that would be worth when if the sun don't shine? This 2-gallon bucket of packs of coffee, you could trade them for whatsoever you want.
That's it.
You could probably get a new car for one packet of coffee.
Keep in mind, do not trade your coffee with the infected, no matter how many cars they offer. Of course, that's just a joke. Let me say that again for our YouTube overlords. That was a joke. Please don't demonetize this episode. Because sure, the coronavirus outbreak is scary, but most people are handling it like rational adults.
Ukrainian residents clashed with police on Thursday, protesting against evacuees from China quarantined over the coronavirus from entering their town.
So that's not good. But I'm sure people in other places are handling it like rational adults. What's that, Shelley? Hysteria over coronavirus in Italy is reminiscent of the Black Death. Shelley, is anyone handling it like rational adults? What? Armed robbers steal hundreds of toilet paper rolls in Hong Kong? Ugh, humanity. Despite the warnings from the World Health Organization, they are also cautioning against panic.
So therefore, I think we have to be very, very careful not to drive fear in the world right now. The risk is very high in China. It is high regionally, and it is high around the world. That is not the risk is high of a pandemic. The risk is high that the disease may spread further. And I think at face value, that is true.
Then again, I think I saw that guy with several crates of coffee and several hundred rolls of toilet paper. Now, according to official figures from China, new cases of the coronavirus are slowing. But Chinese officials have lied before at least 1 or 2 million times. So it's hard to say where we are on the spectrum of the rate of new cases is slowing down and 70% of the world will be infected. But with new outbreaks in South Korea, Iran, and Italy, things aren't looking great. So how is the U.S. preparing for a coronavirus outbreak? According to the director of the National Institute of Allergy and Infectious Disease, the U.S. will prepare for the worst possible scenario. What's the worst case scenario? We run out of cars to trade for coffee? The U.S. government has to bust out the National Toilet Paper Reserve? Well, CDC Director Dr. Robert Redfield might have a better answer.
What is the worst case scenario here in the United States?
So far, we've been able to contain it, but I think this virus is probably with us beyond this season or beyond this year, and I think eventually the virus will find a foothold and we will get community-based transmission, and you can start to think of it in a sense like seasonal flu. The only difference is we don't understand this virus.
Okay, so how is the U.S. preparing? It's kind of a good news, bad news situation. First, the good news. The U.S. Centers for Disease Control is on the ball. They've prepared testing kits for the coronavirus and distributed them to hospitals. They've been uploading the virus's genome to a publicly available database so more people can take a crack at decoding it. And they've managed to grow the virus in a cell culture. That helps with further testing. But it doesn't stop there. The U.S. has suspended entry of foreign nationals who have been in China within the past 14 days. And if you're a U.S. citizen who was in China, you can return to the U.S., but you'll be monitored and possibly quarantined. Sure, quarantine sounds bad, but while quarantine centers in China may be terrible, in the U.S., they're a bit nicer.
Nice hotel for us, and 3 meals a day, and just go get it. And all we need to do is take temperature twice a day. So it's kind of a vacation, it's kind of relaxing, really good.
Can I be put under quarantine? U.S. hospitals have benefited from the CDC's rigorous screening and quarantine protocols. They've used the time to review their pandemic plans, and it's allowed them to consolidate medical supplies such as masks, gloves, and gowns and order backup reserves in case of a widespread outbreak in the United States. Hospitals are also educating the public about safe practices, like basic hand hygiene, sneezing into the end of your elbow, and practicing safe distance from someone who is sick. Unless, of course, the sick person is Asian, in which case, please don't be racist. There's also a race to discover a cure for the coronavirus. The U.S. Department of Health and Human Services is even partnering with pharmaceutical companies to find a vaccine. And depending on your perspective, massive government agencies partnering with massive pharmaceutical companies to create vaccines is either a fantastic partnership or the scariest idea ever. In general, though, the nation's healthcare system is better prepared than it has been in the past, according to a Health and Human Services representative. That's because the U.S. has already had to develop protocols to deal with other potentially dangerous pandemics, like Ebola, as well as SARS and MERS, which are both types of coronaviruses. There is also a strategic national stockpile of medical supplies, including millions of face masks and supplies of respirators, gloves, and surgical gowns that could potentially be deployed if state and local supplies are diminished during this current outbreak. And perhaps the best news we have is that even in the face of a deadly pandemic that could infect 70% of the world, America still has enough optimism for fear-mongering partisan attacks. Now for the bad news. You know those test kits the CDC sent out? They may be flawed. I guess that's what happens when health organizations are chronically underfunded. Hospitals will have more than that to worry about. A larger spread of the new virus across the U.S. could overwhelm emergency rooms and quickly cause supply shortages of some crucial medical supplies. That's an especially serious problem because U.S. hospitals are already dealing with peak flu season, and because a huge amount of the world's medical equipment is made in China, like the N95 masks that hospital workers wear to prevent viral infections. China is also a major supplier of raw ingredients needed to manufacture penicillin, ibuprofen, aspirin, and other routine medications. In retrospect, trying to save a few bucks by outsourcing to China seems like not such a great idea. Another potential issue is health insurance. Like this guy who came back from a business trip from China and went to the hospital because he was worried he might have the coronavirus. Turns out he just had the flu. And now, according to his health insurance, he owes at least $1,400 for a flu test. If people are worried about healthcare costs, that could discourage them from getting tested, which could spread the disease further. Anyway, all this is why, according to bioterrorism and biosafety expert Dr. Tara O'Toole, no one is ready for a worst-case scenario for a really bad, lethal, fast-moving pandemic. So with that, remember to wash your hands. Also, stock up on cars, so you can trade them for packets of coffee in the apocalypse. No word yet on what the car to toilet paper exchange rate will be. And before you go, did you know the World Health Organization is horribly corrupt? And that's putting your life at risk. For more, check out our recent episode on China Uncensored, Coronavirus, How WHO Corruption Helped It Spread. Also, did you know YouTube is demonetizing nearly all of our coverage of the coronavirus? It encourages me not to talk about this stuff. But I'd like to continue to ignore pressure from YouTube. And that's why I need your help. To keep making America Uncovered, I rely on your support on the crowdfunding website Patreon. Go to patreon.com/AmericaUncovered to learn more. It'll also help me buy tubs of coffee for the apocalypse. I'm already hoarding toilet paper. Once again, I'm Chris Chappell. Thanks for watching America Uncovered.